a urologist. Our job is to take care of the urinary tract of the male and female as well. But for male, they have this specific problem called erectile dysfunction. The main feature of this problem is the failure to get a penile erection strong enough for sexual intercourse. The term is actually coined by the National Institute of Health in America. That's back in 1992. That was actually many years ago. I think that's 26 years ago. And the term has been used since then. The short form is called ED. Nowadays, actually, a lot of patients actually, identify themselves saying that, I have a problem of ED. So it's quite a common problem. You call it impotence for simplicity, but prior to 1992, everybody called that impotence. Yeah, but nowadays the scientific term and the commonly used term is ED, which is erectile dysfunction. Yes. Right. The erectile dysfunction, of course, the incidence increases with age. It's more common in older people, less common in younger people. There is a statistic in Malaysia, but not a whole country survey. There are specific community survey. For example, there is a urban-rural area. They've done a scientific survey involving, I have a data here, involving 350 adults, an average age of 50 to 60. And they found that in that age group, about 70% of the adult male have erectile dysfunction. They have ED. But the ED don't all belong to the very severe group. Some are just mild ED, some moderate, Of course, the small percentage of them will have very severe ED. Roughly, we have the figure here. The mild one is about 30%, the moderate is about 20%, and the severe one about 15 to 20%. So that is the statistic in Malaysia. Yeah, normally it's above the age of 50. It's more common there. That's how it linked to the heart disease. The heart disease also, the incidence increases with age. So it's reflected in erectile dysfunction. So that is a saying, that is kind of a scientific hypothesis that people think that the erectile dysfunction is a precursor, an early warning sign of a heart problem, because erectile dysfunction involves the dysfunctional blood supply to the penis. Because for men to have proper heart erection, they need adequate blood supply to the penis in order to achieve a good erection. So if they have problem with their blood vessel, there's not enough blood going to the penis, then they will present with erectile dysfunction. So as general, if the person's blood vessel is affected, with the blood supply being less circulated to a specific organ, that organ will face problem. So if there's less blood going to the penis, the person will get erectile dysfunction. And if there's not enough blood to the coronary artery in the heart, they will get that heart attack and they will see a cardiologist. If there's not enough blood to the brain, they will get a stroke. So that so that is a theory that if the person have erectile dysfunction, they should not ignore that, because it could signify a more serious problem involving not only the penis but might be affecting the heart or also the brain.